So toxins can be from heavy metals, they can be LPS, biofilms, microplastics, and the list can be long. So one very important step to addressing chronic condition is to help your body detoxify from these toxins. That's a first step to healing, reversing, and managing chronic conditions. And today we have Dr. Visalam to talk about gut cleansing therapies like colon therapy, Shanka Prakshalan, which is a yogic way of gut cleanse, and various enemas. Dr. Visalam has over 10 years of experience in conventional medicine. She went ahead and trained herself in functional medicine. And today in her practice, she beautifully blends various integrated therapies, yogic practices, and cannabis, and a lot more. So Dr. Visalam, a very warm welcome, and over to you. All right, I will help Dr. Visalam share the screen in case she's having a struggle.
Dr. Visalam, can you hear us?
Yes, I can hear you, just struggling to share the screen.
I'll share it.
Yeah.
Thank you.
Your video is paused here. Yeah.
Please turn on your camera. Yeah.
Yes. Thank you. Thank you so much. Can you all see me?
Yes, we can. Loud and clear.
Yes. Thank you. Thank you so much for this opportunity. A wonderful Saturday. Let's just start with 3 ohms and then we'll start the topic. Just close your eyes for 2 minutes, please. Om. 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 Thank you. So today my topic is exploring modern and traditional gut cleansing therapies, the first step to detoxification. If you remember how Dr. Preeti started her topic, she said, mine is a complicated topic, it's a debatable topic. My topic is extremely logical, very less scientific, extremely logical, but it's still complicated because I had Dr. Preeti do through the webinar before, and I have Siddharth doing after me. So it does get complicated that way, but let's just start. Can we move on to the first slide? Yes, the objectives are very, very simple. Types of detox. LSP is Laghu Shanka Prakshalan or Shanka Prakshalan. Enemas, colon hydrotherapy. Next one, please. What are the types of detoxification? Detox internally and detox externally. Detox internally is how we give binders, chelations, nutrition to allow the body to take the toxins from inside and throw it outside. That is detox internally. Detox externally is a support for the internal detoxification. None of it is good individually. What are the detox externally products? Are Laghu Shanka Prakshalan, lot of enemas, colon hydrotherapy, and the other external therapies that you do like steam, sauna, detox bath, ozone saline. They're all detox externally for you to kickstart your detoxification. Next slide, please. Detoxification. Why do we need detox? Isn't the liver enough? This is a question that we all ask ourselves in the beginning when we are not much into these therapies or supplements. When we all start functional medicine, we believe body will be able to do everything. Yes, body will be able to do everything, provided you put it in a good environment. Now, why do we need these external detoxifications? Is toxic load is increasing. Unrecognizable toxins are entering us, and we are leading a lifestyle that is suppressing our liver and hindering its functionality. So liver is happy to do its job, provided you give it good support. What are we detoxing from? Stored, not used, not helpful heavy metals. Active, infective microorganisms, inactive biofilms, and microplastics. The majority of the detoxification, the toxins of these have to leave. How to detox? Naturally. Eat healthy, drink plenty of water, exercise, sleep well, reduce stress, add supplements and these cleansing therapies. Your regular detoxification routine will help you with all of this. Next one, please. Main sources of toxic load: pesticides, pollutants in all the food, water, air, vaccines, medicines, past and the present infection, daily use cleaning products, hair care, skin care, your utensils that you use to cook, plastic, everything can add on to your toxins. Now, there's one more new term that I want to introduce you to, is called auto-intoxication. Auto-intoxication is from the stored and the impacted stools inside your colon. They act as a breeding source of pathogens, giving rise to many diseases due to reabsorption of toxins. Anything in the colon will get reabsorbed and will reach your liver. So it's called auto-intoxication. The long impacted stool has fermentation and putrefaction happening, delay peristalsis, compress the adjoining organs, blocks elimination, dehydrates colon, and causes dysbiosis. So this can cause your major toxins from the inside, apart from what you're putting from the external environment. Next slide, please. All right, Laghu Shanka Prakshalan. I think the slide is not very clear, but let me tell you what is Laghu Shanka Prakshalan. Laghu Shanka Prakshalan is the yogic way of cleansing your GIT from the mouth until the anus. Laghu Shanka Prakshalan is a shorter form. I will explain that in the procedure. This is the only form of detox that can also help you detoxify the small or flush out the small intestine. Your colon hydrotherapy and everything will only reach unto your large intestine. Laghu Shanka Prakshalan is the only way where you can flush out from your upper GI, small intestine, as well as your large intestine. Now, what are the contraindications of this is because you also drink a lot of salt water, hypertensive patients and cardiac patients, you should not give them this. Children and vertigo, people with injuries, and pregnancy and menstruating women, they cannot do this because it is hardcore yoga. You need to do 5 asanas about 8 times for 11 rounds until you complete the entire thing. So people who cannot do yoga, please do not do this. Now, what are the benefits of it? Who are the people who can do this? Obesity, arthritis, diabetes mellitus, rheumatoid arthritis, all autoimmune conditions, cancer, for them to clean their entire gut at a regular period, in the comfort of your home, please, Laghu Shanka Prakshalan is your first detox method. Next slide, please. This is good. This slide is good. So the procedure of LSP is very interesting. I did it the first time in my yoga therapy, the 30-day yoga therapy course. Is we drink warm salt water slowly but continuously in a squat position. After we drink about 400 ml, about 250-300 ml, you drink salt water and you do these 5 asanas. Tadasana, Tiriyaka Tadasana, Katti Chakrasana, Tiriyaka Bhujangasana, and Uttakasana. You do all of these 5 asanas, and each of these asanas is done 8 times. You do this, you take a walk, you come back, you again drink the same 200, 250 to 300 ml of water, again repeat these exercises. Probably if it's your first time, by the 4th cycle or the 5th cycle, you will start passing motion. Once you start passing motion, then you will again come back, drink, do this, come back, drink, do this. This is a cycle that you keep on repeating until you pass motion like urine. Trust me, guys, this is magical. If you've done LSP, it is magical. Because then you're like, how can my stool be like urine? You know, it will come out that clear. And that entire day, because you're doing so many asanas and you've let out so much water, you will feel tired, but your mind will be so awake. My guru used to tell me that is the time that you meditate for your Kundalini alignment and everything. But otherwise, LSP has helped me in treating all the chronic diseases, fatigue, lethargy, and SIBO, SIPO. It's helped me treat all of those patients. Next slide, please. Enemas. This is the detox therapy that has been happening even before, we can document. That's the time that enema is happening. What is enema? Enema is a fluid injected into the rectum for the purposing of clearing out of the bowel. But today we have more purposes, which we will get into. History is, of course, Egyptian. People do it, Indian, Chinese, Asian. Everybody did it. We even did it for children. I'm sure Sushruta did it. All of us know what enema is from time that we all know medicine existed, right? What is the indication? The commonest indication is constipation, fever. In fact, during fever, if you actually give herbal enemas, fever will come down. Digestive disorders, obesity. Contraindications are bleeding, piles, pregnancy, intestinal obstructions. More than stimulating the bowel movement, enema helps in detoxification via the liver pathway. How is rectum? We know has a maximum blood supply and fantastic absorption back. So whatever you put in the rectum and hold it for more than 10 minutes, that will take the rectal villi will take it to the blood absorption, will take it back to the portal pathway, and it will reach the liver for it to detoxify. Not only detoxify, but also stimulate the liver. Especially today, us functional medicine practitioners, we give a lot of coffee enemas. The coffee enema, especially the one with high palmitic acid, has known to increase the glutathione production for the detoxification. Next slide, please. What are the types of enema? You can actually start from simple water. I do not recommend soap enema, which is given in allopathic ones, but all the other enemas are very, very good. And enemas also have less side effects because they are from the rectum. They will be eliminated any which way, right? So the herbal enemas, the neem and fenugreek enema seems to play a good fenugreek in terms of diabetes, neem enema in terms of infections. Buttermilk enema is again a proper enema that is given to cool down your body from the back. Water enema can be cold, warm, and hot. Coffee enema is what I told you. And in Ayurveda, you have Kashaya Vasti and Sneha Vasti, and all of these practices are given in Siddha and Ayurveda since the day that we know. In fact, one of the metaphor that I wanted to tell is imagine that our body as a house of our soul, right? I mean, not just imagine, that is the truth. If we put in garbage, then we should make sure that our cleaning equipments are bigger, better, and maybe costlier. So that's exactly what enemas and colon hydrotherapy does, because today we are unable to stop the garbage. So what we will do is we will have to tolerate it, make sure we find other ways to reduce the garbage burden, but also help the cleaning mechanisms. Next slide, please. Yes, colon hydrotherapy has just become my favorite in the past few years. Earlier, I was not for it, but recently I've become this big fan of colon hydrotherapy because I could see the differences in patients. I could see differences personally. And it's a painless, not much invasive therapy. It's kind of fun. You should all try it. But anyways, what is colon hydrotherapy? It's a procedure where 40 to 50 liters of pressurized water, both hot and room temperature water, is flushed into the large intestine to loosen out impacted stool and eliminate them. What is the history of colon hydrotherapy? So there is something called Bahishtra, which as theoretically I heard from my yoga therapies, where the yogis will get inside a river and do some yogic practice, take their intestine out of the anus, clean it and push it back inside. Very difficult. Don't try it. Don't do it. There are better ways to do it today. And this colon irrigation by Dr. Kerr Russell, it's a ancient book in 1930s, was the first book to be published on colon hydrotherapy. Somehow in the year 1960, the trend disappeared. It's also the same years where all the medical cannabis and psychedelics was also banned. Something to do with 1960s. We need to go back that history. But yes, and then it resurfaced 20 odd years back because Siddha and naturopathy and all of those departments started coming, and allopathy slowly started not finding cure for chronic diseases. That's how it resurfaced. Next slide, please. Types of colon hydrotherapy. There are two types which I only learned for the conference, which I didn't know, even if I took great love towards colon hydrotherapy. There are two types of colon hydrotherapies. One is a closed colonic system. The other one is an open colonic system. Very simple. Closed colonic system is where your output, that is your eliminated stools, comes out through a tube and goes outside wherever you let it go. Whereas the open colonic system is more like your cleaning in a bathroom in a commode, where the patient just freely passes. The closed colonic system is commercially used today, is manual. Like I told you, the stool goes out in a tube. The commonest one is the Woods gravity method, where you don't even need to have the machine. You just hang the tube 3 feet above from the patient. The water will go inside. The patient will pass out. The water will go inside. The patient will pass out. Pass out the stools. Patient will be conscious. The second one is the open colonic system, otherwise known as the Libet system, where you have, if you can see the picture, you almost like a lying down commode side, where you have a pencil-like speculum go inside you with pressurized water. And when the patient feels full, he just passes the motion out. This is the open colonic system. And here you don't need a therapist. For the closed colonic system, you need a therapist. The next slide, please. Procedure. I am only telling you the procedure so that we negate the nervousness if you have. I know my own friends, my own doctors who has not taken even one colon hydrotherapy, even if they prescribe it. So this is to take out the fear or whatever fear that they have. So the patient that is a picture, the blue one, that is a picture in my setup. So you lie down there, and there's a speculum that goes inside your anus, of course, non-painful. Then you have an inlet tube and an outlet tube. There's a therapist who's sitting right next to you. Now, when the patient is ready, you open the valve and you let water inside. When the patient says, I'm full, you let the water outside. And there's an outlet tube. You can see what is coming out in the outlet tube. If you have not seen a colon hydrotherapy, please just go see a colon hydrotherapy. You will be able to see corn, tomato skin, coriander, not fresh ones, people. These are year-long impacted stools that so these are food that they've not bitten, that they've not chewed, that they've not digested, which gets impacted in your colon. The reason for all the diseases that they come by. Let's just say, okay, it might not be, year-long stools. It could just be today's food. But today's food, if I have tomato skin and corn in the stool, you've not done the job that you need to do. You cannot expect your stomach and intestines to do the job that they need to do. It will affect your health. So please get colon hydrotherapy done. At least go see one before getting it done. Here in our clinic or in most of the setups, what we do is we give them a far infrared sauna session. In fact, we have our manufacturers. I'm not sure if Manish is here, but far infrared sauna, and then we give them a colon hydrotherapy session. The next day, we put them on a liquid diet. Liquid diet can help loosen out those stools. Then the third day, we give them food reflexology, and we give them a repeat colon. That completes one session. Next slide, please. Thank you. That completes one session. I will tell you the protocols. The protocols which we use for weight loss is I give them colon hydrotherapy, far infrared sauna, coffee enema, far infrared sauna, and then repeat the same thing. So this is one block. Repeat the same thing for 4 blocks for weight loss especially. And for hormonal conditions, I give them once a week for 6 weeks. For autoimmune conditions, I give them for twice a week, 4 weeks, depending on the condition of the colon hydrotherapy. Apart from the actual physical science of colon hydrotherapy, is like I told you, stool rectum can be a breeding place of infections and all of that. Apart from our science that we know, like acupressure, acupuncture, in our Chinese medicine, each of the parts of your colon is linked to many other organs of yours, like your teeth. You know, if you have a functional dentist, they will tell you each teeth has a meridian, right? It affects your meridian. And if you have impacted stool in that part of the colon, then if it's linked to your liver or heart, you will get cardiac issues. You're prone to cardiac issues, or you're prone to autoimmunity, you're prone to cancer, you're prone to brain and everything. So the impacted stools also affect the meridians, leading to an array of other diseases, energy-related diseases. So it's just not the physical stool we're talking about. We're also talking about how the impacted stools and that part of the colon is associated with other parts. And this impacted stool can have disadvantages over the other organs. So in whichever way, you know, scientific way, spiritual way, energy way, whichever way, clean your colon, right? And there are two extra things that we can do with colon therapy. Is one is we can also add it with ozone. You know, you can do colon therapy and ozone, which is very, very germicidal, and like rectal ozone, it'll also increase your antioxidant levels. Ozone is another big thing that you can do with colon hydrotherapy. And you can also give rectal probiotics. There is one school of thought that says, because we're washing out the colon for so many times, we're washing out the good bacteria as we're washing out the bad bacteria. But if you actually give a rectal probiotic retention, that will sort those people out. Now, coming to the benefits of it, is first and foremost is parasitic detoxification. Today, we know parasites are like the biggest causes. That, you know, in stages of functional medicine, we think bacteria is bad. Then at one stage, we think virus is bad. One stage, we think parasites are bad. I am at the stage where we think parasites are the killer microorganisms, right? So let's just kill them first, but let's eliminate them first. Colon hydrotherapy will give you 100% good results with parasite detoxification, constipation relief, leaky gut, because where doctor was talking about zonulin right before me, but leaky gut is once you take away these impacted stools, then you will have good reabsorption, good hydration from your colon, which will lead to patching of the leaky gut. Weight loss, hormone balance in terms of thyroid issues or PCOS, mental stability. You're washing out all your bad bacteria, parasites, everything. That by itself will give you good mental stability. Autoimmune conditions, any autoimmune condition for the matter, please start treatment with cleaning the colon. Cancer, of course, I know for post-cancer, one of my senior doctors give 3 days continuous colon post-chemo, and they give continuous coffee enemas for 21 days for cancer patients. It will help in hydration. It will help with dysbiosis. Your bodily mucus will reduce. In fact, normal Walker says if you do not have mucus in your body, no amount of microorganisms can affect you. So it will reduce your bodily mucus, will improve your immunity. And because you have impacted stools, the adjoining organs, be it prostate, testes in men, be it ovaries, uterus in women, be it kidneys, adrenaline in both, all of these are compressed because of these impacted stools. Now, if you release all of these organs will have more space, maybe to breathe, but they'll have more space. All your skin and hair issues will reduce. And longevity today is the fad topic, colon hydrotherapy. If you do not detox yourself, longevity is not the first place that you go to. But colon hydrotherapy will help you with longevity. And next slide, please. If you will nourish your body properly, keep your colon clean and mind elevated, your liver will take care of you. Answering the first question, your liver will take care of you. Now, series of colon irrigations will save a life, and that life might just be yours or your loved ones. If anybody is taking anything in this webinar, get a colon hydrotherapy done and also prescribe it to your patients. Now, if you have any questions, I'm happy to answer. I have 1 minute left.
Thank you, Dr. Visalam. That was explained in a very simple way. A lot of questions, so maybe I'll just take so one question is, any precautions to be taken before colon therapy, because many times patients do come with certain bad experiences after having undergone colon therapy. So anything from your end?
Right. So we have certain contraindications for colon hydrotherapy. One is active hemorrhoids, piles, and you need to go on at least, you cannot eat now and then get a colon hydrotherapy done. It will not help that way. I do have certain patients complaining of gas after, but otherwise no much issues. If you have hypertension, if you have high BP right before colon hydrotherapy, better to avoid colon hydrotherapy. I think, which is also why we send them inside FIR. FIR somehow seems to reduce the hypertension, and then we take them to colon hydrotherapy.
So that answers the question why, why FIR. So
it kind of relaxes them, and it kind of, I think it stimulates the detoxification process. So colon hydrotherapy becomes better.
Yeah, okay. One last question. Do you want to shed some more light on coffee enema? What kind of coffee to be used?
Yes, so we, it's better if you use organic, chicory-less coffee, well-powdered coffee. So for 1 liter, you take about 4 tablespoons of coffee, make coffee, strain it twice so that it has no grains. And then you can give up to 500 ml of coffee, as much as they're able to hold it. But if they hold it for 30 minutes, well and good. I remember my first coffee, Anema plus rectal ozone. I came back jumping, and I was telling my father, something is great. I'm jumping. So you will have that much energy and you will feel that much good. It's great.
I'm sure everybody is looking for energy.
Yes, we are.
Yes. Great. So thank you so much, Dr. Visalam. I request you to please stay back for some time and answer a couple of questions we have in the chat.
Sure. Thank you so much.
Thank you.